Subscribe now for easy-to-understand health tips. Dr. Madam. Your headache won't go away. Back pain is keeping you up at night. You reached for a painkiller at 1 o'clock, and questions started popping into your mind. Is this medicine safe? How many times can you take it? Will it harm your stomach, kidneys, or liver? Today, in very simple language, we'll directly address those questions that people most commonly have about painkillers. Let's get started. What exactly is a painkiller? A painkiller is a medicine that reduces pain, but it doesn't always treat the root cause of the pain. However, it provides relief until the body recovers. This medicine can be used as tablets, syrups, injections, suppositories, or even as gels, creams, or patches. Now 1 o'clock, a very important point. Even though there are so many types of painkillers, there are mainly 3 types. The first is paracetamol, which is usually the first choice for mild to moderate pain, fever, headaches, or body aches. It does not reduce inflammation or swelling, but when taken in the correct dosage, it is quite safe. The second type is anti-inflammatory painkillers, which we call NSAIDs. Examples include ibuprofen, diclofenac, and naproxen. These are useful when pain is accompanied by swelling or inflammation, such as in joint pain, muscle injuries, or arthritis. However, these are not suitable for everyone. They can affect the stomach, kidneys, and heart. That's why doctors prescribe these with careful consideration. The third type, opioid painkillers, are used for very severe pain, such as after surgery, major injuries, or cancer pain. Codeine is considered a mild opioid, while morphine or tramadol are strong opioids. These are very effective. However, they carry risks of constipation, drowsiness, confusion, and addiction. Now the most common question is, why does the doctor prescribe a particular painkiller? This depends on 4 things: the type of pain, the intensity of the pain, whether you have any other illnesses, and the side effects of the medication. For mild pain, paracetamol is used. For pain with swelling, NSAIDs are used if they are safe. And for very severe pain, painkillers are given for a short period of time. The next question is, how should painkillers be taken? Some painkillers are taken only when needed, while others must be taken regularly for a certain period. For example, if you take paracetamol every 6 hours, the pain does not keep coming back. NSAIDs should always be taken after food, otherwise they can harm your stomach. And most importantly, use the lowest effective dose for the shortest possible time. Now, a major concern, is it safe to take painkillers for a long time? Taking them for a few days or even a few weeks is generally safe, but if you take them for a long time, the risks increase. That's why, for chronic lower back pain or fibromyalgia, treatment now involves not just medication, but also exercise, physiotherapy, sleep, and support from others. These aspects are also given importance. Now, let's talk about side effects. NSAIDs can cause stomach ulcers, bleeding, kidney, or heart problems. Paracetamol is safe at the correct dose, but taking too much can cause severe liver damage. Opioids can cause nausea, constipation, drowsiness, confusion, and carry a risk of addiction. That's why the correct dosage is very important. Now, a few short but very common questions. Can you take painkillers with antibiotics? Yes, it's generally safe. If you have an upset stomach, paracetamol is better. Which painkiller is safe for high blood pressure? Paracetamol. NSAIDs may be advised to avoid. Painkillers during pregnancy. Paracetamol is safe. NSAIDs or codeine should not be taken without a doctor's advice. For the kidneys, the safest painkiller is paracetamol. NSAIDs can harm the kidneys. Which medicine works for nerve pain? Regular painkillers often don't work, so some antidepressant or anti-epileptic medicines are used. And the final question, how quickly do painkillers work? Usually they start working within 30 to 60 minutes, and their effect wears off in a few hours. So, for short-term pain, taking them regularly as prescribed is beneficial. Lastly, remember that painkillers are helpful, but they should not be taken lightly. The right medicine, at the right dose, for the right duration. This is the key to safe treatment. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. If you found this information helpful, please share it with others, Because good health begins with awareness.